Hi everyone, as we cover learning outcome number 3 of module 5, we're going to be talking about the blood distribution within the entire body. As we can see from this graph, the total blood volume is going to be unevenly distributed among the arteries, the veins, and the capillaries. The colors do represent the type of blood that is going to be circulating. And as we can see, there is going to be less red in this graph. Therefore, this means that there is much less oxygen-rich blood in our body. And these that have the word pulmonary in them are part of the pulmonary circuit. And if we add all of them up, there's going to be roughly 9% of blood circulating in the pulmonary circuit. So this means that 90% of the blood circulates in the systemic circuit. Now the heart, the arteries, and the capillaries, they will contain approximately 30 to 35% of the blood volume. This would be about 1.5 liters of whole blood. And this includes all the pies on this graph that go from the systemic capillaries all the way to the heart. Now this leaves the venous system holding the rest of the blood, which is about 65 to 70%, or about 3.5 liters. And why is this? Well, this occurs because the walls of the veins are actually thinner, and the combination of the elastic tissue and smooth muscles, they do allow the veins to be more distensible, more stretchable than the arteries. And for a given rise in blood pressure, a typical vein will stretch about 8 times as much as a corresponding artery. We can also say that the capacitance of blood vessel is actually the relationship between the volume of blood it contains and the blood pressure. And veins are called capacitance vessels. And because veins have high capacitance, they act as blood reservoirs, which can actually accommodate large changes in the blood volume. And if the blood volume rises or falls, the elastic walls, they will stretch or recoil respectively in those veins. And this will create a change in the volume in the venous system. And this is also why veins, they're not the blood vessels that leave the heart, because they would not be able to withhold the pressure of the blood leaving the heart. They would actually burst. And it is important to notice that arteries, they do have large numbers of elastic fibers when compared to veins, but these elastic fibers, they're actually tough fibers. They're not as stretchable as you might think, but they are able to accommodate the pressure of the blood that's leaving the heart, and then they return to their original shape. You can think of veins being like rubber bands that stretch a lot, and when you place them on a table, they don't maintain their shape, so you guys can try this out at home. And think about the arteries as being like girdles or fajas. These only stretch a little to be able to keep the shape of the body. Maybe not the best comparison, but I hope it helps you to understand this concept of elasticity and elastic fibers that are present in veins and arteries. Now, these characteristics of vein are very important because they do serve as what we call a blood reservoir. So, for example, if you have a serious hemorrhaging, which basically means a lot of blood loss, the sympathetic nerves, they are going to stimulate the smooth muscle cells in the walls of the medium-sized veins in the systemic system to contract or constrict. And this process is what we call venoconstriction. Makes sense, right? So a constriction in the veins. And this reduces the volume of the blood within the venous system, right? So if you're constricting, then there's less blood circulating, and therefore you're reducing the volume of blood. So this will reduce the volume of blood in the venous system. Therefore, it increases the volume within the arterial system and the capillaries. And reducing the amount of blood in the venous system maintains the blood volume within the arterial system and near normal levels despite the significant blood loss when you have, for example, a shark bite. And as a result of this, the blood flow to the active skeletal muscles and delicate organs such as the brain, they can be increased or even maintained. Now, the venous system, therefore, will act as this blood reservoir because they're constricting the blood vessels, so no blood is actually coming out and going towards the inferior vena cava to then continue its trajectory in the systemic circulatory system. Now, the liver is the one that will act as the primary reservoir, and the change in volume actually constitutes what we call the venous reserve, which normally amounts to just more than 1 liter of the total blood volume. And since we have roughly 5 liters of blood circulating throughout our body, this would represent 20% of the total blood volume. So this is how individuals that have serious injuries and a lot of blood loss, they don't die because of the venoconstriction and the fact that you have certain organs, as an example, the liver, which is the primary reservoir, that will accumulate the blood and slowly release it when it's needed so that your brain specifically does not get deprived of oxygen until you're able to get medical help, and this will allow your chances of survival to increase.